Hello everyone, it's Mimi and I'm back to review week 15 of this pregnancy. I would say that pretty much everything's the same for the most part. Just had a lot going on, staying busy like usual. And the symptoms that I have been having, first I guess I'll just do my cravings. I've had some serious cravings for anything spicy, salsa, cheese, all the things that I should not eat having Crohn's disease. And it's what I'm craving. It's what I want. And I pay the price for it sometimes, but gotta have it. Like, I just want it. I love it. And I'm craving it. And sometimes I give into those cravings. So, anyways, I wrote some things down this time. Finally, my pregnancy peeing has finally kicked in. Like in my previous vlogs, I hadn't had any of those issues with having to pee in the middle of the night. I'm just going to say it. And now I'm having to wake up to use the restroom. And I'm, also urinating a lot more during the day. And I don't know if that's just from, taking in more fluids now that it is hot outside and I spend a lot of time outside in the summertime. So, and that's another thing I wanted to talk about because since I spend so much time in the sun, I use a lot of sunblock. For one, I'm just freaked out about skin cancer and, wrinkles because I'm not getting any younger. But my skin tends to get very dark very easy. And I just think that has to do with my nationality or the mix of. But anyways, so for whatever reason, I've been lathering myself in sunblock and I just keep getting shades of brown, which is fine. I don't mind having a little bit of color, but I just don't want to get burnt up. But I think being pregnant, it seems like my skin seems to be getting a lot darker. Just, going and sitting on my back deck or something, I'll come in a couple shades darker, and I hadn't put sunblock on because it's in the morning. But that's fine. A little bit of color, is good. All the, what is it, vitamin C in the sun is supposed to be really good for you. And I have had hives really bad. That started 3 days ago. Sometimes I get them. I get them when I'm pregnant, and when I'm not pregnant, it's just something that I've had for going on about 5 or 6 years now. I just randomly get hives. And so I do have them right now, like on my chest area, my tummy, my legs. So anyways, that's not fun, but it's not the end of the world either. So this is not very pretty. Another thing is this week, the things I have been eating a lot of is a lot of soy products because that's what I'm allowed in my diet. Sorry, my shoulder's kind of hurting here in my neck. And I'll go into that in a minute. I'm having soy. I'm having a lot of nuts because I know almonds have a lot of potassium in them. And I tend to run low on potassium even with my prenatal. So I try to get that in since I can't eat spinach, which I love spinach salads, but I can't have spinach. So I'm trying to get that in. So nuts are a really good one. Almonds, lady. They're really good on potassium. And protein, of course. They are high in fat, but they're good fats. So another thing is my face still hasn't cleared up. It's still being weird. It will be dry and it will break out, and I'm moisturizing and everything like that, and doing scrubs and doing masks, and so I'm just going to keep doing the best that I can do with it. And I care, but I don't care because I'm not a supermodel. I'm not trying to be, I try to look my best, but there's not much I can do but, take good care of my skin and hope that it starts to just kind of level out now. So I'm hoping that kind of clears up. You probably can't really tell in this video, but And I do have a hat on because I was out in the sun and we just got home from baseball and it's really hot here already. So anyways, yeah, my face is still being weird. My skin is still being weird. I have hives. But these are just my symptoms. I'm going to keep it real with you guys. You know, it is what it is. And I'm going to put all the good things in and all the little unfun things in. Sorry, indigestion. Yay. That's awesome. Not really. Anyways, it is now officially summer vacation for my sons. So that's really nice. It's going to be different having them home. I always look forward to that because I'm really outdoorsy and we love to just swim and, you know, go boating and, you know, just camping and just take, you know, vacations during the summer when we can and, you know, do a little bit of traveling or whatever it is. I like to work outside and, you know, in our yard and things like that. And I don't know, I'm an outdoorsy person and I think my kids are too. And, you know, they like to play basketball outside and we have a basketball court. So I go out there with them. And so it's just kind of fun. I love summer. It's my favorite season because I just feel like I can be outside more because I do not like the cold at all. And if it's not 80 degrees or more, I don't like it. So, yeah, I did grow up in the South. So I think I'm just accustomed to being in the warm temperatures. And I've never adjusted to where we live now. So I'm hoping to get back home soon, one of these days. And, you know, make it back home south. So we'll see. Anyways, let's see what else I have on here. I have not done any baby buys. I'm really leery to do those, just to be honest with you. I'm not comfortable doing them until I have the scan. Maybe it's superstitious, but that's just how I am. I don't want to buy anything. I just don't want to yet. I don't feel like, now when I do go buy stuff, I will be buying quite a bit, I'm sure. But until I have that scan and I know the baby's fine, I know it's fine, but I just want to make sure I'm halfway through before I go purchase anything for this baby. Anyways, another thing is I have not felt the baby move this week at all. I just assume that's normal. I hope it's normal. I really haven't. Maybe I've just been busy and haven't paid attention. Okay, here's the not fun part. So yes, these are symptoms, but these are also Crohn's related. And so, you know, like I said, these might not apply to you women who, you know, a regular pregnancy. But I will talk about them just because I am documenting this for myself. So it's kind of a vicious cycle. Due to the Crohn's, you know, I still have had the vomiting and TMI, some diarrhea and stuff. Well, unfortunately, due to the vomiting, it has aggravated my neck. And this is a problem, and I'll tell you, in my shoulder, and I'll tell you why. Because for many years, I worked in a high-end salon, a full-service salon, where I did massage therapy, I did hair, you know, cutting, coloring, everything. I was an esthetician. Excuse me. So, you know, doing that for years and years, it did do some wear and tear on my body. And, you know, I have a torn rotator cuff. Should probably have surgery on that. You know, I'm trying to put that all off as long as I possibly can. I needed surgery on my neck for some bulging disc. Well, unfortunately, to the vomiting and everything that's going on, I don't know if I wanted the bulging disc in my neck or if I just totally ruptured it at this point. I tried to not move my neck as much as possible because the more I move it, the more it hurts. But the more I don't move it, I'm sure that's not good either. I've been to physical therapy before. I've been through it all. I've seen a surgeon, you know, he just said you know, I'm young to try to put it off as long as I could, but I do need surgery. But I'm not one for surgery. I'd rather try to suck up the pain, but unfortunately, due to the vomiting, yes, it has aggravated that. And so now I'm dealing with that issue. So again, not really pregnancy related, but due to the Crohn's issues, which, you know, causes a spiral effect. Because, you know, it is a chronic illness. It causes other issues. So I'm running out of time here. Let's see. Lower back pain, I went through that. I think I told you guys about that. I don't know if I did or not. I've had some lower back ache, and I think that's like my hips, and that, I'm not sure on the term on it, but that relaxing, that's kind of, I'm really like pregnancy brain. Pregnancy brain is here. Oh, I have a guest. My daughter Azure just decided to join me. So, anyways, I am going to have to wrap this one up. And I'm going to do a separate vlog for the belly shot. And then in my belly shot, I'll tell you guys what all I'm planning on doing. Yeah, my little bell is here. On the next vlogs that I really want to do, that I'm looking forward to doing. So anyways, I've got to cut this short because I've got my baby here, my Miss Azure. Say hi. Say hi, Belle. Anyways, well, I will see you guys for the belly shot. Alright, sorry I had to cut this one short, but you guys know what it's like when you're a mommy. Yeah, your kids come first, so... Alright, Ian, do you want to say hi? We can't see your face. Hello. Say hi, YouTube. And that's my Ian. Anyways, alrighty, well, I will see you guys for the belly shot for week 15. Alright, bye.